Om Swastiastu, Assalamualaikum warahmatullahi wabarakatuh, salam sejahtera bagi kita semua. Hello everyone, so we are from small group discussion B9, and now we want to present our student project assessment that the title is Antiviral Agent for Management COVID-19. And this is our small group discussion member list. And this is the structure of our student project. And let's start from the chapter 1 introduction.
Okay, my name is Madikina Devi Savita. My student ID number is 200251197. And this is the background. Antiviral agents are drugs that have been validated to or approved in the United States, especially by the Food and Drug Administration, which are used to control and treat an infection that occurs due to virus. And this is a disease caused by a new coronavirus, where previously this virus was not identified in humans. This virus spreads through droplets or saliva places, and this is the objective to give a better understanding about antiviral agent, to provide an explanation to reader about COVID-19 that happening now and the antiviral agent that used to it, and the last is to acknowledge the reader about the example of antiviral agent. Next.
So my name is Putri with student ID number 200251102. And the benefit of this student project assessment is the reader will understand and improve their knowledge about the antiviral agent, COVID-19, and what antiviral agent that can be used to manage the COVID-19. And the problem formulation to making this student project is what is antiviral agent, two, what COVID-19 spread, how COVID-19 spread and how to diagnose it, and what antiviral agent that can be used for the treatment of patient with COVID-19.
Okay, my name is Kadek with student ID number 200251189. I will continue the presentation about antiviral agent in general. So we all know that virus is a living thing that can cause many disease in human body. Virus can cause disease because it can use the energy of the cell for their replication so that the host cell can't do their function and that. To eliminate the virus from the host cell, the use of antiviral agent is important. These drugs have approved by FDA or Food and Drug Administration for virus infection medication and control. The antiviral agent is mainly targeting the life cycle of the cell, and the antiviral agent can use for acute and chronic viral infection. In acute viral infection, the antiviral agent goals is to reduce the complication and the severity of the illness. And for chronic viral infection, the therapy is to prevent the viral damage to visceral organ. Next.
So now I'm gonna explain about the history of COVID-19. Firstly, my name is Putu Ardisa Pradasuari with student ID number 20025111172. As we all know, worldwide has been attacked by a new virus, which is the novel human coronavirus disease. This virus has become the fifth documented pandemic since the 1918. This virus was officially named Severe Acute Respiratory Syndrome Coronavirus, which is SARS-CoV-2. SARS-CoV-2 is believed to be a spillover of an animal coronavirus and later adapted the ability from human to human. That's all about the history of COVID-19. Thank you.
Okay, for the symptoms for COVID-19, my name is Phoebe, Ezkiella, Nathanael, and my student ID number is 20025111169. Are going to explain this part. So common symptoms that a patient of COVID-19 may experience are fever, dry cough, and fatigue. However, in some instances, some people may sometimes experience stuffy nose, sore throat, headache, muscle ache, chills, diarrhea, nausea, and conjunctivitis, and loss of smell and taste. But according to WHO, in 1 in 5 people with COVID-19 becomes gravely ill. These individuals may face shortness of breath, loss of appetite, pressure in the chest, and confusion. In this occasion, patient may develop severe complications of respiratory failure, sepsis and septic shock, acute respiratory distress syndrome, thromboembolism, and or multi-organ failure that can eventually lead to death. Next.
My name is Anak Udayana with my student ID number of 202-207. I'm going to talk about the diagnosis of COVID-19. Diagnosis of COVID-19 is what we usually call rapid test and swab test. Both of these differ in its accuracy in the period of time before the result is available. Rapid test based on a percent antibody produced by persons. The use of antibody detection doesn't have 100% accuracy. It is possible that the virus actually had been eliminated from the body, but the antibody will still exist in the body. Otherwise, swab tests will provide better accuracy to detect the virus since this method utilizing RT-PCR, which will detect the existence of the virus inside the body. The weakness of this method is the required time is longer than the rapid test. That's why, for the early diagnostics, we still need the rapid test. Thank you. Next.
Thank you. My name is Putri dari Sari. My student ID number is 200-251-2511177. So the development of COVID-19 in the world has made many researchers and pharmaceutical companies try to find the suitable drugs for the cure and treatment. Remdesivir is one of them. Remdesivir is a monophosphoramide drug and is kind of antiviral drug that was synthesized and developed by Gilead Sciences in 2015. When it first developed, actually it was a treatment for Ebola hemorrhagic virus and Marburg virus infection. But in January 2020, Gilead Sciences started to test remdesivir for the treatment of COVID-19. After its success to cure SARS and MERS. After that, remdesivir has used to treat the SARS-CoV-2 patient in the United States for compassionate use, and the patient's condition improved and become well, but it can be confirmed that this treatment can make this patient completely cured. Remdesivir works by attack and inhibit the basic viral RNA, and pulmonologist medical doctor explained in COVID-19 patient, virus that enter the body will stitch in ACE2 receptor and will enter in lungs tissue and replicate themselves. Remdesivir inhibits viruses that stitch to ACE2 replication. Thank you. Next.
My name is Anagung Ragujan Parawangsa with student ID number 200251193. So I will explain about the favipiravir. So favipiravir act as an inhibitor to the RNA-dependent RNA polymerase, or ADRP in RNA. From there, it can be considered that favipiravir have an active antiviral activity to counter the SARS-CoV-2 in vitro. In the past few months, there are many clinical studies been testing the efficiency of favipiravir against COVID-19. Both China and Japan have been done it, but still couldn't find the definite result.
Okay, my name is Bagus Ugrasena. My student ID number is 2025111184. So additional studies are needed to verify the clinical enjoyment standard treatment drugs. Thus, in conclusions, favipiravir may emerge as a valuable drugs in the treatment of mild to moderate symptomatic COVID-19 infected cases. So, in the right side is a picture of favipiravir drugs. Next.
Okay, my name is Evangelina Vincent Oetami Lacerda with student ID number 2002511170. So in this slide, me and my friend were going to talk about oseltamivir. So the first point, as we know, as an antiviral drug, mostly in primary hospital that handle the coronavirus disease 2019, use oseltamivir as a first-line antiviral drug. Oseltamivir is included in the management protocol for the coronavirus disease because oseltamivir is often used for influenza therapy, especially in Indonesia, because the drug is already exists. And the second point is oseltamivir is an antiviral drug which the activity by inhibiting viral neuraminidase enzyme activity were found on the surface of the virus, which prevent the batch from the host cell, viral replication, and infectivity.
Okay. I will continue the presentation. First of all, my name is Wulansiwi Widiantara with my student ID number is 2002511173. The clinical benefit of oseltamivir is greatest when it is within 48 hours after the occur of influenza symptoms. Even this drug is widely used in China and some countries, but there is no evidence to show its effectiveness for the COVID-19 because oseltamivir is effective against SARS-CoV-2 in vitro study. Next.
My name is Kusuma, student ID 200251178. I'm going to explain about lopinavir and ritonavir. So lopinavir and ritonavir has been suggested as a therapy for COVID-19 based on in vitro motion, preclinical research, and observational inspection. So lopinavir is a HIV-1 protease inhibitor, which is participate with ritonavir to create its plasma half-life. So ritonavir was initially intended to hinder HIV protease, yet its capacity to restrain cytochrome P450 and 3A4 is these days considered more noteworthy and sensitive, as it is more frequently used to expand the bioavailability of the antiretroviral drugs, which is co-managed with. So there are 1,616 patients were haphazardly distributed to get lopinavir ritonavir and 3,424 patients to get ordinary deliberation between March 19, 2020 and June 29, 2020. So the SARS-CoV-2 infection is a solitary abandoned RNA beta COVID. So the chemical 3-chymotrypsin like protease or 3CL-Pro assumes a pivotal function in handling the viral RNA. Next.
My name is Kirana Putri with my student ID number is 200251168, and I'm going to tell you about the conclusion. The world has been attacked by COVID-19, which was first reported in Wuhan and subsequently spread worldwide. This virus is highly contagious, which causes symptoms such as fever, malaise, dry cough, and dyspnea. The ways to diagnose COVID-19 are rapid tests and swab tests. The development of COVID-19 in the world leads companies to try to find suitable drugs to cure. Remdesivir is an antiviral drug that has large spectrum activity and is effective against any virus families, such as filovirus and coronavirus. Favipiravir is an antiviral that acts as an inhibitor to the RNA-dependent RNA polymerase and potentially shortening the duration of viral shedding. Oseltamivir uses antiviral activity by inhibiting the viral neuraminidase enzyme activity. Lopinavir is an HIV-1 protease inhibitor, which is joined with ritonavir to build its plasma half-life and could lead into disrupting the cycle of viral replication and delivery from having cells. Thank you. Next.
So that's all that we can explain about our student project assessment, and this is all the reference that we use for making our student project. We hope this presentation gives a lot of information and knowledge for everyone. And last but not least, we close it with thank you.
Thank you.